Cardiovascular diseases are the #1 cause of death worldwide. They describe a class of diseases involving the heart, cardio, or blood vessels, vascular. In this video, we focus on the two most common forms of cardiovascular disease: coronary artery disease, including heart attacks, and strokes, which together account for 75 to 80% of cardiovascular deaths. Heart attacks and strokes do not only lead to death, they can also cause years of crippling pain and cognitive or motoric deficits. The main underlying mechanism of many cardiovascular diseases, atherosclerosis, also plays a role in erectile dysfunction and vascular dementia. The good news is, atherosclerosis is preventable. It does not need to exist at all. Remember to subscribe to our channel. Heart attacks in women. Women have a 50% higher chance than men of receiving a wrong diagnosis when having an acute heart attack. They die more often from the first heart attack and are more likely to have a second heart attack within the next 5 years, 40% compared to 14% in men. The longer a heart attack stays untreated, the more heart muscle can be irreversibly damaged. This can happen when the afflicted person and close ones fail to recognize the signs and symptoms of a heart attack. Damaged heart muscles lead to heart failure and lower short and long-term survival rates. Please familiarize yourself with the signs and symptoms of heart attacks in both women and men, for yourself and for your loved ones. Strokes in women. Men have a higher risk of suffering a stroke in a given time frame. But because women live longer on average, more women than men suffer strokes. And on average, they are significantly older than men when it happens. Consequently, women surviving a stroke have twice the rate of disability compared to men, defined as being unable to take care of themselves independently. The incidence of strokes in women aged 45 to 54 years is on the rise because of the growing rate of obesity and metabolic syndrome in middle-aged women, an alarming trend. We highlighted the severity of cardiovascular diseases in women to raise more awareness to the fact that women suffer as much from cardiovascular diseases as men, if not more. Cardiovascular deaths. About 1 in 3 deaths is caused by cardiovascular diseases, and heart attacks and strokes account for 75 to 80% of all cardiovascular deaths, meaning that 1 in 4 deaths is caused by either a heart attack or stroke. Although the chance of surviving an acute heart attack or stroke is surprisingly high, especially in younger people, it can still cost you dearly. Your mortality risk multiplies following a cardiovascular event. It is estimated that 65% of heart attack survivors die within 8 years, and about 70% of stroke survivors within just 5 years. That is similar to the 5-year survival rate of 90-year-olds. We should give our best to prevent the progression of atherosclerosis in the first place. But even after a first cardiovascular event, there is still a lot we can do to increase our chances of survival. Atherosclerosis describes the build-up of plaque in arteries, leading to restricted blood flow and blockages, coronary artery disease, leading to heart attacks, and most strokes are caused by atherosclerosis. The restriction of blood flow to the heart and brain can cause massive pain and cognitive impairment, even without the occurrence of heart attacks and strokes. Most heart attacks do not happen in the most severely blocked arteries, but those that are only 30 to 40% blocked, where the plaque can loosen and suddenly block the entire blood flow. It might surprise you, but heart surgeries, like stents or bypasses, have no benefits outside of emergency settings, no increase in survival rate, and no improvement in pain and symptoms either. The build-up of plaque does not happen overnight. It takes years and decades to form and become life-threatening. There are many modifiable risk factors we can work on to reduce the risk of atherosclerotic plaque buildup. Definite modifiable risk factors include diabetes and insulin resistance, elevated blood lipids, smoking, intake of trans fats, abdominal obesity, hypertension. Less certain modifiable risk factors include intake of saturated fats, intake of excess processed carbohydrates, sleep deprivation, sedentary lifestyle, alcohol consumption, and chronic stress. Diet-driven disease. Many risk factors for atherosclerosis are related to diet and lifestyle, and many of them can improve within a short period of time. Over 80% of type 2 diabetes cases are reversible within a few months. The same is true for insulin resistance. Blood lipids can improve in a matter of weeks, so can hypertension. The intake of trans fats, saturated fats, processed carbohydrates and alcohol can be avoided and limited immediately. The adverse effects of abdominal obesity can also improve in a matter of weeks to months after just a few pounds of healthy weight loss. Easier said than done, especially if your doctor only had a few hours of nutrition classes and knows next to nothing about the reversal of insulin resistance, hypertension and healthy weight loss through dietary and lifestyle modifications. Even worse, there is so much contradictory information on nutrition, especially when it comes to diabetes and insulin resistance. Whole food plant-based. The best scientific data we have on stopping the progression of atherosclerosis and improving symptoms and survival points in the direction of a low-fat, whole food plant-based diet, accompanied by various lifestyle modifications, like smoking cessation and stress management. The early works by Pritikin, the Ornish lifestyle heart trial, the successful interventional trials by Dr. Caldwell Esselstyn Jr., the same dietary and lifestyle modifications also show benefits for type 2 diabetes, hypertension and weight loss, which are major modifiable risk factors for atherosclerosis. A low-fat, whole food plant-based diet consists mainly of vegetables, fruits, intact grains and legumes. The Ornish diet also allows a minuscule amount of nuts and seeds, in the order of a few grams per day. Sounds extreme? Well, dying from heart disease and open heart surgery are extreme. There are large differences between the actions you need to take for prevention versus treatment. If you do not have type 2 diabetes, hypertension, elevated blood lipids, are not overweight and do not show any signs of heart disease, you do not need to follow a low-fat whole food plant-based diet. Your fat intake can be significantly higher, especially if you are reasonably active. You also do not need to eat 100% whole plant foods, just mostly whole plant foods. Most people believe that their diet is reasonably healthy, when in reality it is not. If our diets are fine, how come 1 in 3 of us will die early from a preventable disease? We hope you liked this video. It might have been a bit direct in its message, we mean no offense. You can find various videos and websites linked in the description box, in case you are interested to learn more about this topic. Thanks for watching. See you next week.